Welcome everybody to our first day of the Virtual Health Summit. I am so excited to get started. I have Lindsay Nelson here with me. She's a registered dietitian, and we are going to be talking about polycystic ovarian syndrome, PCOS. And before we get started, I'll just let her introduce herself and tell us a little bit about her background and what she does and how she helps people.
Yeah, thanks for being here. I've been in private practice for the last 3 years, I believe, going on 4. And I specialize mostly in PCOS. I've been a dietitian for 12 years. I live in the Kansas City area with 3 boys. And yeah, I was diagnosed with PCOS myself back in, I forget what year, but it's been like probably 15 years. And ever since then, I just wanted to learn more about it and how to manage it naturally. And once I was able to really figure that out for myself, I became really passionate about it and wanted to teach other women how to live with PCOS and really how to manage it with lifestyle and nutrition.
Yeah, that's amazing to have that personal experience and then combine that with your educational knowledge and experience and to really help people. Well, to get started, let's just talk about what is PCOS?
So PCOS is an endocrine condition. It affects about 10 to 20% of women. So it's characterized by extra testosterone and male sex hormones, which can lead to like extra hair growth, like on the chin, cheeks. It can lead to male pattern baldness, acne, all caused by that high testosterone. It's also characterized by lack of periods or like irregular cycles. So some women may only have one period a year, some may have a period 30 days and then 60 days. It can be just super irregular. Um, and it's also usually PCOS women are insulin resistant. So they might have blood sugar issues, high insulin. Um, so those are the main things that really characterize PCOS. So to be diagnosed, you have to have 2 out of the 3 categories, being irregular cycles, high testosterone, and then cysts on your ovaries by ultrasound. So you get to have 2 out of those 3 criteria to be diagnosed.
Great. Yeah. Thank you so much for going over all of that. And I think one thing to highlight is kind of what you said about how common PCOS is. I don't think everybody realizes that. And so it's really important to be aware of. And if you're having any of those symptoms, to talk with a provider and see if you can narrow down that diagnosis. And I think one of the first questions that a lot of patients that I have, if they have a diagnosis of PCOS, is they wonder how it may affect their fertility. And so, can you talk a little bit more about that?
Yeah, and actually, a lot of women don't even find out they have PCOS until they start trying to become pregnant and then they can't. So it's actually the number 1 cause of female infertility. And the reason is it goes back to that irregular cycle. So when you're not having regular periods, that means you're not ovulating regularly. So if you only have maybe 2 periods a year, that means you're probably only ovulating 2 times a year, which means you only have a chance of getting pregnant 2 times a year, for like a few days each of those cycles. So that's the main reason why is because that lack of regular ovulation. So to make your chances higher of getting pregnant, we have to figure out how to get your body to ovulate. So usually, in like the conventional setting, women are giving certain drugs that can help them ovulate, which can definitely work and does help a lot of women. But you can also do lots of things naturally to help your body start ovulating on its own and having regular cycles. Um, so part of that is lifestyle. Most of it is lifestyle. So really learning how to eat in a way that helps your body start ovulating naturally, and kind of getting to the root of why you're not ovulating. So maybe it is high insulin. If it's high insulin, we can control that with certain diets and supplements. High testosterone can stop ovulation from occurring. Even something like vitamin D deficiency. So being deficient in vitamin D alone can stop ovulation. So really addressing all the root issues that can stop ovulation, and then introducing things that can help your body start balancing those hormones. So there are certain supplements, like I love the supplement inositol, that I use for most of my PCOS clients. So it helps to really balance hormones and can help the body start ovulating on its own, and also helps a lot with blood sugar and insulin resistance. So that's one I use a lot for PCOS. And there are some other ones too, like maybe Vitex or maca roots that really benefit the body and help the body to start balancing hormones on its own, and then helping with ovulation and therefore getting pregnant. So there's lots that can be done naturally to help someone's fertility with PCOS.
Yeah, thank you for going over that. And I'm glad you brought up inositol. With me being a physician and I've, gone through my medical training, we learn mostly about prescription medications. And one of the ones that we learn about for PCOS is metformin. And it wasn't until sometime in the past year or so I was doing some research on PCOS and read about inositol, and there have been studies where they're really quite equivalent at their effectiveness, and many people tend to tolerate inositol better than metformin. So I think that that's really fascinating and something that, like I said, I have just learned recently, but I'm glad hopefully is, becoming, other people are becoming more aware of that option.
Yeah,
Um,
it works really well.
I don't know, do you have a particular brand that you use out of curiosity, or or does that depend on the patient?
So there are two brands I like. For PCOS, the research has been done on both myo-inositol and D-chiro-inositol. So you want to have a 40-to-1 ratio. So the two brands that I typically use are Fairhaven is one of them. They have that blend. And then also Ovositol is probably the most well-known one that a lot of people see online and different like influencers and stuff using it. But yeah, I would say the Ovositol is probably the main one that most people are familiar with, but the Fairhaven brand also does have the the right like ratio of the myo-inositol to the D-chiro. That's really beneficial for PCOS.
Great. Yeah, thank you for going over that. And then after fertility questions, a common question that I get with my patients about PCOS is weight management. Can you talk a little bit more about how PCOS may affect weight management for these patients?
Yeah, so since insulin resistance is one of is very common with PCOS, that is usually like the reason why it's harder with PCOS to it's harder to lose weight, easier to gain weight. So a lot of my PCOS clients say like no matter what they do, like they just can't lose the weight. And they'll say like if I just look at a cookie, like I'll gain 5 pounds. So it's usually goes back to that root cause of insulin resistance, which is one of the main drivers of PCOS. So really figuring out the correct carb balance, carb and protein balance to help manage someone's blood sugar is key. And a lot of times I'll have clients who maybe their fasting glucose was normal, even their A1C might be normal, but when we check their fasting insulin, it's high. Because a lot of times that fasting insulin will be apparent. It'll become high before we see it in A1C. So that's something I always ask my clients to request from their doctors, get that fasting insulin so we know if that's playing a part in their weight gain. And then really working on balancing out their macronutrients at every meal. So always having protein and healthy fats with a carb. I always tell my patients not to eat a naked carb. So not eating a carb by itself, always having like fat or protein to go along with it. And that's going to help a lot with that blood sugar balance and therefore the insulin. So once we get that insulin under control for a lot of my clients, they're able to lose that weight if they need to lose weight and maintain a healthy weight once they get that insulin and blood sugar under control.
Yeah, great. I totally agree. And thank you for going over that. What are some other risks that patients who have PCOS should be aware of? What are other complications that may pop up in the future? Um, or, yeah, the other risks associated with PCOS.
So when you have PCOS, you are more likely to have different types of like metabolic diseases, so like diabetes and heart disease especially. Um, And that does go back to that insulin and blood sugar. So getting getting like the insulin and blood sugar under control as early as possible and maintaining that definitely decreases the risk of diabetes in the future. Same with heart disease, like insulin plays into heart disease too. So like getting that insulin and blood sugar in control and like healthy cholesterol, really eating a high fiber diet, eating anti-inflammatory foods, all those things can definitely decrease the risk of getting heart disease, but just having PCOS does put you at a greater risk for getting those things. Also different types of like female cancers, like ovarian cancer, you're more likely to get ovarian cancer in the future if, and like endometrial cancer, if you go long periods of time without having periods. So another reason why you want to get your body like having cycles and having regular periods to decrease your risk of cancer in the future. But those are the main things. Oh, eating disorders are another thing that are like more common with PCOS. And a lot of that goes back to like the weight gain and being told over and over again that you need to lose weight to manage your health better. But then when you try to lose weight, you can't because you have PCOS and you're insulin resistant. So that can drive people into disordered eating. So that's also pretty common with PCOS.
Yeah, thank you. And again, how we started off with mentioning how common PCOS is in women. I just go back to the importance of knowing this diagnosis because there are a lot of things that we can do to help with your symptoms, but also knowing that it can be associated with all these other conditions down the line. So it's important to be aware of as soon as possible so then you can manage it and then prevent those complications or lower the risk down the line. So thank you for going over that so everyone's aware of what to watch out for. Um, Speaking of how to manage the symptoms, what are some of the treatments of PCOS?
So conventional treatment is usually medications like birth control is prescribed really frequently, metformin, spironolactone for like the extra facial hair and acne is really common too. And those medications can definitely help cover up those symptoms, but they can't get down to the root cause. But for some women, like if their symptoms are so severe, like it's maybe a good thing to get on those at first until they kind of learn to manage it with their lifestyle. But it's very doable to manage it without having to rely on prescription medications. Um, once you like really learn how to manage it with diet and lifestyle. So really eating a diet that's anti-inflammatory, focusing on lots of plant foods with lots of fiber, lots of green leafy vegetables, lots of healthy fats like avocados and olive oil and fatty fish, nuts and seeds, beans, learning how to balance out your plate. So learning the correct balance for your body as far as like fats and carbs and proteins at every meal, um, exercising consistently. So studies show that getting at least 75 minutes of vigorous exercise every week can drastically decrease PCOS symptoms. So yeah, if you're trying to manage it more naturally, those are the things I really focus on is like really like honing in on your diet and figuring out what works best for your body, figuring out what supplements are going to work best for your body. That's something I see too with a lot of my clients. They go online and they see like a list of 30 supplements that might be helpful for PCOS. So either they're on like all of them and they're just on too many, or they're so confused they don't start any of them because there's way too much information. Some of it's good, some of it's misinformation. So people are just confused. So working with somebody who can help you pinpoint like what supplements or what medications are best for your body by working with their doctor and dietitian um, can make a big difference. But it is super important, like you said earlier, like to learn early on, like how to manage it since it is a chronic condition. So if you can really figure out how to like what works best for your body, then it's very doable. It can just be part of your lifestyle. It can feel kind of scary when you're first diagnosed, but it's definitely very manageable and can be something that's pretty easy to live with once you get the hang of it.
Yeah, absolutely. I'm curious, do you have like oh, a recommendation of how to start some of those changes? Like, do you tend to say, let's make all of these changes at once, or do you prioritize them with your clients? Or does it depend on the person that you're talking to? What does that kind of look like when you're starting a treatment plan?
I definitely like to work in baby steps because it's too overwhelming to change everything at once. So I usually have my clients kind of set two or three goals to start with, some baby step goals. Maybe it's increasing steps. Maybe it's going from like 5,000 steps a day to 7,000 steps a day. Maybe it's just increasing vegetables, going from like half a cup a day to a cup a day. So making those small changes and taking it step by step. So normally it takes like multiple months for my clients to like go from point A to like, or not point A, but like to start from like step one to whatever step they need to get to step 20. So just taking those small baby steps, and then it makes it a lot more doable. Taking it one step at a time, and a lot of times it's like two steps forward, one step backwards, and that's okay. That's normal because life happens. Um, but it's good to go slow because then it becomes a habit and it becomes easier to make it part of your lifestyle.
Yeah, I totally agree. And I take that approach with my patients as well. And then you also know what is working for you and what's not when you do it that way. Because if you're making so many changes, or like you said, if somebody starts several supplements at one time, and if you have a reaction, you don't know which one it's to, or if you're having benefits, you don't know what that can be attributed to. So I definitely like the one or two at a time to start off with, much more manageable.
Yeah.
Um, all right. So, I see Emily here. Do you have any questions for Lindsay about PCOS?
Yes, I have PCOS, um, but I had a question specifically about the type of activity because I had been told that I have to keep my cortisol level down, and certain kinds of activity could maybe increase that too much. Or do you have a certain regiment that maybe would be, I don't know. I mean, I know resistance training in there would be beneficial, but also I just wanted to kind of pick your brain about what kind of activity looking like, because I don't know. I feel like I kind of get all over the place sometimes. Um, and maybe it's because of just what day it is. Because every little thing you said was like a check mark for me. Even the eating disorder part, I have struggled with that for years too. So anyways, just wondering your thoughts on the activity part.
Yeah, so it kind of does depend on the person, but since stress is an underlying driver of PCOS, it is important to um, like really listen to your body and know if your exercise is causing more stress in your body. I usually try to steer people away from doing like high intensity, like HIIT type exercise like every single day. Um, I've had some clients who like were doing CrossFit and that was too much for them. It was causing too much stress on their body. So maybe like CrossFit style workouts every single day is too much. But I think it's okay to do like some intense exercise throughout the week, maybe not every single day, but doing it when you feel like when it feels good to your body. That also depends on maybe like what part of your cycle you're in. So for someone who is in their follicular phase, like right around ovulation time, their body naturally has a lot more energy and you have more motivation. That is a good time to do more of those intense exercises. But if you're in like luteal phase or at the beginning of your period, maybe you need more like yoga and gentle walking. So I think just a good variety is really good. Getting some gentle exercise like yoga, walking in nature, also doing some resistance training, and then also doing some of that higher intensity exercise, like kind of sporadically to get your heart rate up,
Mhm.
but not making that your main form of exercise.
I think that was always the like push was to do the when I had a trainer, he was always wanting me to do more high intensity to try and get that fat loss. But I just it was just it was so much for me. And when I was younger, I'm 35 now, and I've had two babies, and the two pregnancies were pretty rough for me. And then even after, it's like been a shift as well too. So anyways, there's just that was just one thing that I had heard, and I thought maybe that was affecting me. It was almost like it was wearing me out so much that then I didn't feel like even doing going on a simple walk sometimes, because it just, I don't know, it's like that roller coaster of hormone shift kind of would just all of a sudden be down. So anyways, just kind of curious about that. Thank you for your answer.
Yeah, you're welcome. And you mentioned having like being in that postpartum period. That's a time when they're probably stress is a lot higher, cortisol is higher. So that time, I definitely do recommend like doing more of that gentle exercise, not doing high intensity for somebody postpartum or somebody who's not getting a lot of good quality sleep. That's definitely a good time to do the lower intent, like yeah, the calmer exercises. Maybe still doing weights, but maybe it's like 15 minutes of like dumbbells and squats while your baby's playing on the floor, like not overdoing it, especially in that postpartum time is really important.
Because I just switched to myo-inositol, and that because I was on metformin, but I had such difficult digestive issues with all the I don't know. It was getting pretty difficult after postpartum with taking metformin. But when I came off the metformin, it's like my cravings were amplified more, and I needed something. And then I was researching about that. So that was helpful to hear that okay, I'm on the right track. Because it is overwhelming, all of the supplements that do get listed, or here's this recommendation, here's this recommendation. So that was good to hear that.
Yeah, well, thank you for that great question, Emily. We appreciate it for sharing a little bit about your journey and your story. So kind of to wrap things up, do you have any last minute thoughts or things you would like to share for anyone else listening in the future?
I guess the main takeaway is that PCOS is very doable. It's very, or it's doable to manage it naturally with diet, lifestyle, supplements. So it can be scary when you first get diagnosed with it and you're not sure what it really is, and you read about it and hear about the risk, but there's so much that you can do and so much that is in your control, which is how like the choices you're making every day, and that can definitely pay off in the end and make it a very natural lifestyle once you really get the hang of it.
Great. Well, that's exciting. And if anybody would like to get a hold of you or learn more from you or work with you, how would they do that?
So I have a website. It's Lindsay at, no, it's not. It's lindsayNelsonRDN.com. And then if you want to find me on Instagram, I'm at virtual.pcos.dietitian. So just reach out and I'd love to work with you and chat to you about your PCOS.
Great. Well, thank you for sharing all of your knowledge. This was super helpful. I know I learned a lot, and I think everyone else is going to learn so much and have great takeaways from this conversation. So again, yeah, thank you so much for doing this, and I look forward to collaborating more in the future.
Yeah, thanks for having me. It was fun.
Great. All right. Well, the next two talks were actually pre-recorded, so I will send out the links to those recordings later today, so you'll have access to that. They were about binge eating disorder and gut health, and then tomorrow we're talking about stress management. We're going to go over all the different macronutrients, and then we are talking about diabetes as well. So those will be the topics tomorrow, and that starts at 2 p.m. Central Time. And same thing, we'll also send out the recordings as well if you cannot attend those live. All right, well, everyone have a great rest of your day.